Hi, I'm Dr. Scott Goldstein from the Oculoplastic Service here at Wills Eye Hospital. It's a pleasure to speak to you about a patient that presented here to Wills with a long-standing gunshot wound injury to his face and orbit. Our patient many years ago, unfortunately, was an innocent bystander and was struck in the left eye by a bullet that had been discharged from a gun down the street of his home. The bullet traveled through the left eye socket, through the nasal cavity, and lodged behind the right eye after doing some damage to the right optic nerve and globe. The patient was unfortunately legally blind, but did have some vision, was able to maneuver and get around and still go on to live a productive life, but nonetheless has had significant morbidity from this long-standing injury. In ophthalmology and in medicine, our goals are to help preserve vision and to do no harm. And initially, I felt this patient had a recurrence of a cyst that had appeared in the right orbit several years after his injury and was removed elsewhere. Fast forward another 10 years, this lesion presented again with a firm mass in the inferior lateral right orbit that was pushing the globe upward and causing some pressure and discomfort. Imaging study was a little difficult to interpret because of the artifacts from the large bullet lodged in the bony structures behind the right eye. Nonetheless, I thought that he would probably have a cyst, and we took him to the operating room to explore this area and remove what was hopefully going to be a quick surgery. Unfortunately, we found an extensive infection around the large bullet that was lodged deep into the bony structures of the orbit and not easily removable. As such, we treated him with antibiotics and rinsed out the orbit and hoped this would be the end of this most recent occurrence. However, he had several recurrences of the infections over the course of many months, and at this point, the patient and I came to the conclusion that despite the risks of orbital surgery on a monocular patient with suboptimal vision, that the bullet needed to be removed. So after long thought process and discussion of the benefits and risks, we took the patient to the operating room and performed an anterior orbitotomy to get to the large bullet that was lodged in the zygoma and sphenoid area of the posterior right orbit. Using delicate surgical techniques, as you can imagine, we retracted the globe superiorly and medially, protecting the eye and the vital structures with malleable retractors, and then went on to use high-speed drills, a hammer, a chisel, and some other instruments to gently and gradually free up the bone around the bullet and remove the bullet from the scar tissue that encased it for so many years. Since the patient had his surgery, he's gone on to do well with no recurrence of his infections. He had no further deterioration of his vision from the surgery, and thankfully is moved onward after this long saga of many years in his life that has left him with emotional baggage and functionally blind, but in a happier and better place.